So we're presenting our PBL case on a woman named Angel. Kristina, Taylor, Kira, and I have collaborated to analyze Angel's case. Next slide. So we'll start by taking a closer look at Angel's background. She's a 28-year-old female who initially experienced neurological symptoms while she was studying for her PhD program. As she was taking her notes, she began to have trouble seeing out of her right eye, experienced numbness and weakness on the right side of her body, which prevented her from being able to take notes properly. And she tried to ignore the symptoms at first, but after a while she began to feel dizzy, so she went to lay in her bed, and she still didn't think much of it, so she kind of ignored her symptoms. And by the time her roommate came home, she found her in her bed, dazed, confused, and unable to speak. Her roommate took her to the hospital immediately and had to provide support to help her into the car. But unfortunately, because of the amount of time it took from the first symptom to the moment her roommate got home, plus rush hour traffic on the way to the hospital, there was a delay of about 5 hours between onset of symptoms and treatment. And at the hospital, she was diagnosed with a left middle cerebral artery stroke, specifically affecting the posterior distribution, which is known to impact language areas. By the time Angel came in to see us, it's been about 2 months since her stroke, and she presented with fluent but empty speech, poor auditory comprehension, and some depressive symptoms.
So pre-stroke, we see that Angel was outgoing and had a very active social life. She would regularly go out with friends, grabbing dinner, spending time together, and would meet up for soccer scrimmages. Upon intake at the hospital, we learned that Angel has use of a hormonal birth control, which has side effects of possible stroke. Her family also has a history of diabetes, which is another possible indicator. She also, during her soccer days, she had experienced multiple TBIs in high school. And her grandfather also suffered a stroke in his 70s, but lived into his 80s, passing from other measures not related to the stroke. Next page. So our patient presented with a negative affect, which is we inquire about her well-being. She's indicated that she's had a hard time adapting to her new reality post-stroke and is struggling with specific symptoms. She, prior to coming to us, she completed the stroke aphasic depression questionnaire about 1 week before her appointment, and the results from the questionnaire indicated depressive symptoms similar to those discussed during the appointment. Additional symptoms post-stroke that we observed include a loss of content words, use of paraphasias, and difficulties in receptive language. As a PhD candidate, strong auditory comprehension skills are going to be essential. So we, as a team, agreed that further assessments are recommended in order to properly guide treatment and improve her quality of life. Next, we'll discuss our assessment plan.
So the purpose of our assessment plan is to identify any deficits, strengths, and then guide our treatment approach. So we formally assessed Angel's language using the Western Aphasia Battery, which showed impairments in 3 areas of criteria with fluency remaining intact. The Boston Naming Test, which produced an initial failing score of 1 at the hospital and a failing score of 3 during our assessment. And lastly, the Ravens-colored progressive matrices, where she had a passing score of 30. The RCPM was administered nonverbally in order to assess cognitive functioning, where she received a passing score of 30. Then, using one-step commands, Angel's informal assessment showed a failing score of 30. Next page. The results from the assessment led us to diagnose Angel with severe Wernicke's aphasia, with strengths in fluency, preserved grammar, prosody, and some repetition. Deficits included auditory comprehension, meaningful word use, and self-monitoring. As such, we have settled on Lachol's stimulation for her treatment approach with 2-hour sessions 3 days a week and a 1-hour session once a week practicing communication partner training with Angel's family. Angel's progress will then be reassessed after 5 weeks of treatment. Next page.
So to dive deeper into what Schwell's stimulation approach is it's a approach that targets auditory comprehension, which is one of Angel's biggest weaknesses. It uses intensive, repetitive, and structured tasks to support semantic retrieval and word associations. It's also evidence-based for clients with receptive language deficits and is particularly effective for those with Wernicke's aphasia. It also allows for multimodal support, such as visuals and gestures, which can be added based on the client's needs. We also plan to include partner training and environmental supports to help Angel communicate effectively in real life settings. So, therapy would begin with targeted auditory comprehension tasks, such as asking Angel to point at the apple from related and unrelated picture stimuli. As her comprehension improves, we'll gradually increase the difficulty of these tasks. Next, we'll work on yes no questions, which help assess basic understanding of simple response formats. Difficulty would be increased to following one-step commands and then two-step commands and so on. We will advance to repeating single words and then onto short phrases and common expressions. And from there, we'll begin targeting sentence completion and eventually we'll present short stories and ask Angel to retell them with help of pictures and prompts. So this approach provides the structured, supportive framework that Angel needs in order to help rebuild auditory comprehension and expressive abilities. Next page.
Okay, so our goal for Angel is to just improve comprehension of basic words and phrases, especially at the connected discourse and conversational level. Our goal is for her to also increase frequency of relevant responses, meaning that her intended responses are easily understood by the communicative partner. We also strive to exhibit gradual improvements in her functional language skills that will just overall contribute to her successful completion of her PhD degree. Just to reiterate, her passion for her studies and drive to earn her degree is a huge factor that she has expressed, contributes to her quality of life, and believes makes life worth living. Throughout her treatment, we as clinicians will continue to monitor for signs of frustration or emotional distress, just taking breaks or pausing tasks when needed, and then resuming when appropriate. With the support of family members, we will integrate communication partner training into her treatment. And lastly, we'll remain open-minded to additional functional and compensatory approaches as needed. And these are our references.